Some doctors say they are concerned that they haven't heard as much about some other health emergencies like heart attack and stroke since the beginning of the pandemic. Reveal investigator Faith Abube explains why the perceived drop in some of these other emergencies has some advocates sounding the alarm.
I was baking banana bread and I started to feel like some chest discomfort.
Danielle Denlin remembers it like it was yesterday and not 12 years ago.
It kind of felt like heartburn at first.
Next thing she knew, she was in the back of an ambulance. Denlin was having a heart attack at just 35 years old.
Having a baby and then having a heart attack 5 days later when you're completely healthy, this massive heart attack came out of nowhere.
Had her symptoms appeared in the middle of the COVID-19 pandemic, she says she would have been concerned about going to the hospital so soon.
And that's the last place I want to end up. But I know for sure it wouldn't be an option. Had I not called 911, I 100% would have died.
But anecdotally, cardiologists and other doctors are reporting an alarming trend in the middle of the COVID-19 pandemic. Doctors, including WellStar's Dr. Barry Mangle, say the number of patients coming into hospital emergency rooms for strokes, heart attacks, and other emergencies have dropped significantly.
Across the country and really across the world, a lot of informal polls have suggested to us that there's about a 40 to 60% reduction in some of the emergencies that we normally see, including heart attacks and strokes.
Under normal circumstances, that would be good news. But doctors don't believe the drop is because there are fewer emergencies happening.
It's our concern that people may be staying home rather than risk coming to the hospital during the COVID pandemic.
This is also evident by some of the stories that we're hearing from physicians and nurses of patients coming into the ER, and they actually have had episodes a day, 2 days, 3 days.
Kristen Kyle with the Georgia chapter of the American Heart Association says, with heart attacks, time is critical. The longer you wait, the more heart muscle you lose, and it can't be recovered.
It's a concern for sure.
Just ask Danielle, who did everything right, and still.
I ended up losing 40% of my heart muscle because it took that long technically to get to the hospital, and every minute counts.
These are emergencies. These are not, paper cuts. They are not twisted ankles. Emergencies just don't stop for COVID-19. So the message is really know the signs and symptoms and call 911 if you or a family member or friend are experiencing those.